Zoom.
That's the presentation. So I think we are being live streamed now, so I'll welcome everyone formally to tonight's special meeting of the Municipal Councils of Augusta, Edwardsburg, Cardinal, and Prescott. Great to have who we do have here this evening. I understand it's a busy time, but thanks to everyone for coming out tonight. We do have a couple important issues that we want to cover off this evening, and wanted to have one more of these special tri-council meetings before we move into the election and move into the next term of council next month. So with that, I don't think we need the introductions tonight. We've met enough times around the table. I think everybody knows everyone. So I'll call the meeting to order and look for an approval of the agenda. Recommendation reads that the agenda for the special tri-council meeting in the Township of Augusta, Township of Edwardsburg, Cardinal, and Town of Prescott be approved as presented. Could I ask for a mover, please? Moved by Councillor Young, seconded by Councillor Cameron. Thank you both. Any discussion on the agenda this evening?
I would just like to pick a spot to report on efforts with regard to the South Grenville Municipal Drug Strategy Group.
Okay. Did you want to put that into the round table?
Let's do it.
Mayor Milankovich?
Yeah.
Okay, thank you very much. Anyone else have anything else on that agenda this evening? Comments?
Okay, so maybe that's the appropriate place. I just have one other sort of item that I'd like to just bring to everybody's awareness. If I could just squeeze it in after Mayor Malanka at the same place.
Yeah, sure. And it's up for everybody at that point. The round table is the round table. So if anyone has anything they do want to add at that point, please do so. So I don't believe I didn't call the motion on that. Did I? All in favor? Motion is carried. Declarations of interest. I'm kind of doubting anyone will have any declarations tonight, but I will ask. Seeing none, opening statements, and we'll start my far left this evening and go to Mayor Sayal, please.
Thank you very much, Mr. Chairman. My opening statement is going to be very, very brief. I'm practically waiting for a recharge of battery here, so I'm not going to say a lot. I have a big interest, of course, in the two items that are on tonight's agenda, because I think we can advance those issues tonight, and the timing is absolutely perfect, because we're all coming into the 2023 budget cycle, and as I review some of the material in front of us, I see that there is an implication for a budget here. So I'm really interested that we've got together for this kind of update, and we all know, of course, that physician recruitment is something that affects every one of our citizens in all of our townships. So it's a great issue to be working on together. Thank you very much, Mr. Chairman.
Thank you, Mayor Sayal. Mayor Malankovich.
Thank you very much. Just acknowledge that members of the Augusta Council are absent tonight. In terms of the Deputy Mayor Shaver, he has an annual moose hunting event that was planned well in advance, and so he is was unable to come. In terms of Council Chapel-Holman, she is not running again, and so declined to come. Councillors Bowman and Henry, I'm not certain. But at any rate, just to say that I am pleased that we're having this meeting. For anybody that's campaigning, I'm sure it's coming up as it is with you at the doors that I'm knocking at. They're very much interested in the fact that we're engaging in this partnership, and they're interested in its progress. And the fact that we have at the last meeting indicated that we would be bringing some information with regard to our recruitment and the other aspects. I think as mayors, we recognize that we might face this eventuality, but that it was nonetheless important just in honoring the discussions with the Prescott Family Unit that we present what we know as this time as we're heading into this election into the last days. So I'm pleased that we've gone ahead, and I'm very much interested in what we have here as the status as I say, heading into this election and where everything changes.
Thank you very much, Mayor Malanka. Just a little more from myself this evening, and I'll do this at the lead rather than tack it on to the end. I just want to thank everyone from all three councils for all the cooperation this term. You know, there's been highs, there have been lows, but we're on a real high right now, I would say, with the cooperation that we have with all three municipalities, with Prescott, Augusta, and Edwardsburg Cardinal. We've shown that teamwork can be incredibly effective as well. With the projects we've done together, the economic development we're looking at together now. You know, what's on that agenda tonight? Healthcare recruitment. That's something we're only going to be successful at when we work together with the three of us and also the United Counties and even across Eastern Ontario overall, because none of our small municipalities have that market, have that number of potential patients to bring in significant numbers of new physicians and new nurse practitioners and other health professionals. So that is something we have to work together on, and it's really gratifying to see how much everyone has come together in these last few years, and really most of this. Have the water tower will be going up in the next couple of years. The arena is 60% or so completed now, moving along really well. And of course, we've got the long-standing partnership with Edwardsburg Cardinal with the water and the sewer and the industrial park, and such great employers down there, such as Prysmian and Giant Tiger leading the way. I mean, we've got a lot to offer here, working together as South Grenville with the three municipalities. But the one thing I did want to mention off the top again is, and I don't want to get into a big political issue with this, but I just want to caution about amalgamation. I love what we're doing here now. I think there are incredible things that can be done, have been done, and can be done in the future. But the three of us working together in some ways as a united entity, but also still respecting that local decision making and respecting that local democracy that I think is quite valuable, quite important. And, you know, quite frankly, that there are some real differences between us as well. We share more in common than that separates us. But at the same time, townships, the agricultural aspect, some of the priorities, the county system. So you've got separated, and you've got Prescott as a separated small urban municipality. And then you get into the county system and how that works and so forth. So amalgamation is something that I think is, in my own perspective, it's a bridge too far, but I think we can accomplish all the goals of amalgamation with economic development, working together in recreation, working together in cultural issues, working together in physician recruitment, working together with youth. We can do all that without having to actually formally amalgamate and form one political entity, whether it's the three of us or even more of us here in this area. And the other thing I would add on that is as much as people do think initially, that'd be a great idea, amalgamation, save money and so forth, there are a lot of drawbacks. I'm not going to get into a lot of them tonight the way I see them, but I do want to mention that if anyone is thinking about looking at amalgamation, think of your employees. Think about, you know, our unionized staff here in Prescott, Public Works and Recreation. You go down that road towards amalgamation, there's one way you're going to save money on it, and that's trimming staff, cutting back on services. That's going to be tricky to manage, and it is something that I think really has to be considered if anyone is looking at that in that way. And quite frankly, I think we've proven that we can do what we need to do with our three municipalities without going to that next step. So I'll just leave off on that, but I just want to thank everyone around the table again. This has been some of the most enjoyable, some of the more enjoyable moments of my time as mayor, because I do love working together with our regional partners right here in South Grenville, but also United Counties. I was Joint Services Chair for a few years. I think I'm still the only separated mayor that was on Joint Services Committee. I chaired the Eastern Ontario Mayor's Caucus. I love the regional approach. I think we need to do more of it, but I do think that there have to be certain limits with that. And to me, amalgamation is where the limit is. We can do so much on our own. But I'm excited about the work we've done. I'm excited to see the work that's going to be done moving forward with the new councils. And with that, I've talked too long already. I'll move on. So again, thanks everyone for attending this evening. We do have a number of items, 6 correspondence. The 6A is on the tri-municipal meeting, doctor recruitment email. I believe that is that the email, Mayor Seah, that you sent?
Yes, because right after the meeting that was held in July in Edwardsburg Cardinal, I was tasked with reporting to MPP Clark the discussion as it pertained to physician recruitment. So what you see is basically the email that I sent to his office so that he would be aware of the steps we were taking. And the reason I wanted to keep him informed is, as you know, Mr. Chairman, Mr. MPP Clark did convene a meeting of all 13 mayors That's the 10 mayors from the United Counties plus the 3 separated towns. He did convene a meeting of all 13 mayors just shortly after, I think it was just in July, if I recall correctly. So we know that he's engaged in this issue. And I just wanted to keep him fully aware and hopeful that if there had been any follow-up to our meeting that we would have heard about it before tonight, but he's been busy and I don't have any response as of tonight.
Excellent. Thank you very much, Mayor Seah, for sharing that correspondence as well. Open up, anyone else had any other discussion on that item? Seeing no. So thank you again, Mayor Seah. So that takes us to 7 delegations and presentations. And under 7A tonight, we do have a Planet Youth presentation from David Sompe. He's the chair of Planet Youth with Lanark County. He did present to our council a month ago, I think it is now. It was a few weeks back, but excellent presentation. And we did mention that we are involved in these tri-council discussions. So we did invite Mr. Sompe to come back and give that presentation to the wider group this evening, because there are some really interesting aspects here that are being done out in Lanark, and it ties in a lot of good ways to engage our youth. So with that, I'll turn it over to Mr. Sompe, who's on the screen, of course, joining us this evening. So David, please take it away, and thanks again for joining us.
Well, thank you. It's a real pleasure to be here. Rather, can you hear me okay?
Yes, yep.
Perfect. Perfect, thanks. I think we were joined up till a few minutes ago by Elaine Merkin from the health unit. Hopefully she'll join again. Anyway, I'm going to try sharing my screen, see if that works. And hopefully now you can see a slide which says Planet Youth Lanark County on it. So this is a presentation that I made on the 6th of September. I haven't updated it. I'll make a couple of comments as we go through, but it's the same material. So thank you again for the opportunity to be here. I'm here to talk about a methodology for preventing problematic substance use, or probably a better way to describe it is to promote a healthy development of youth. And this is an evidence-based, scientifically researched method, and it's been shown to be successful in a number of different countries. I'll give you some data on that in a minute, but at a high level, the method looks and recognizes 4 domains which influence the development of an individual, of a youth, and they're displayed at the right side of this slide. So, you know, what happens in the family of the youth, what happens at school, and what happens in that youth's peer group, and what happens and what kind of involvement they have in terms of activities in their leisure time. And the evidence suggests, as it says on the slide, that if you can define what are called risk and protective factors that exist within each of these domains, and if there are more protective factors than risk factors, then the odds are, from a public health perspective, that individuals who grew up in that environment are going to make healthy decisions. So what we're talking about here is sort of analyzing the environment that young people are growing up in and figuring out how we can make that into a healthier and better place to grow. I just wanted to give you this one slide here. This is the results of work that's been done in Iceland over some 20 years. And you can see here, see if my laser pointer works, that on the left side over here, this is where Iceland was in the late 90s. They had the highest rates of substance use by youth in Europe. And if you fast forward to now, their rates of substance use by youth are the best in Europe. And they did this in a very methodical way. What's displayed on this graph is just 3 examples of measures that they use. This is surveys of 15 and 16-year-old students, so grade 10. And this is reporting on a number of students that said they had been drunk in the last 30 days, or smoked daily, or have used cannabis. And I'm specifically sort of pointing to the middle of this timeline here, because as I'm going to show you on the next slide, we've just done a survey in Lanark County of grade 10 students attending high school in Lanark County. And we're somewhere around where Iceland was in 2010. So we're not as bad, if you want to use that term, as things were in the late 90s in Iceland, but we still have opportunities for improvement. So here's a summary of data which is gathered from a February 2022 survey that I mentioned. So in Lanark County, grade 10 students were offered the opportunity to contribute to the survey. 70% of the students that were offered the opportunity did reply to the survey. That's pretty good. It was administered in the schools, and the things that we need to keep in mind is that this is during the pandemic, and we had 2 snow days in the week and a little bit that we had available. The survey was available, so 70% is pretty good. And what you can see is that 33%, these are grade 10 students now that are answering the question, said they had tried alcohol before the age of 13. 12% said they'd been drunk in the last 30 days. And around 20% said they drink alcohol at home and they get that alcohol from a family member. If you look over to the right, you can see that 21% say that they've used cannabis, so the alcohol is around where Iceland was, the cannabis is higher. And you can see the stats for, vaping, e-cigarettes, those kinds of things. So this is what we learned. This is current data. This applies to Lanark County. I would be surprised if things are a lot different where you folks are from. Another data point, which is not presented on this slide, but there's also a question in the survey about, do you feel safe at school? And almost 1/3 of the respondents to the survey said they do not feel safe at school, which is, I think, is of concern. So I wanted to tell you a little bit about how we got here. So Planet Youth Lanark County is a grassroots movement. It was formed after a public meeting that happened in March of 2017 in Carleton Place, talking about the opioid crisis that was facing Lanark County. So during the Q&A, a local doctor and a resident said, hey, has anybody heard about this thing called the Icelandic prevention model? A few of us said, wow, that looks like a pretty interesting thing. Let's look into that. And we ended up forming a coalition with partners, including our existing network of municipal drug strategy committees, to look more closely at this model. We did our due diligence, and in June of 2018, we said, hey, we want to do this. So we're an ad hoc committee. We're not incorporated or anything like that. We have no recurring funding or staff. Everybody's a volunteer, but we did adopt formal terms of reference. The cover page you can see there on the left was adopted in June of 2018, and we're strongly supported by the Leeds Grenville and Lanark District Health Unit. And our host, if you will, is Open Doors for Lanark Children and Youth, which is the local community mental health, child and youth mental health service provider. And they provide us with some back office support, strategic leadership, governance oversight. Any monies that flow to Planet Youth Lanark County are held in trust by Open Doors. One of the major things that we did was we established memorandums of understanding with the Catholic District School Board of Eastern Ontario and the Upper Canada District School Board, and that's the mechanism through which we're able to administer the surveys. So we're the first community in Canada to do that. And so in January of 2020, we were really pleased to be moving ahead. We had a plan of implementing our first surveys in March of 2020, but as you know, something else happened and the world shut down. So our surveys didn't actually happen until February of 2022. So about a 2-year delay because of the pandemic, and which was very disappointing. In theory, if we had been able to get our first surveys done in March 2020, we would have had 2 years to develop community-based responses to that, and we would have been executing our second survey in 2022. So we've had our first one in 2022. The next one will be in 2024. There is a growing network of Canadian and American communities that are adopting this model, and some of the ways that we're communicating on that is there's a so-called North American cohort call. It's a quarterly meeting that's chaired by a group in Vermont. From the state, Vermont was an early adopter of this methodology in North America, but that call also has representation from West Virginia, Kentucky, Alaska, other communities. And one thing that's interesting is that all of these communities tend to be kind of more rural. They're not big cities. There's also a group in Ontario that's looking quite closely at this, and that's a group that's chaired by someone from the Southwestern Health Unit. And there's multiple Ontario communities that are investigating this IPM, this Icelandic prevention model. And other Canadian communities who have formally adopted the model include 4 communities in New Brunswick. It's a provincial initiative. They'll do their first survey later in 2022. And in April of 2022, Calgary, led by the United Way of Calgary, announced that they are a Planet Youth community, and it's the whole city of Calgary that's adopting that. And they're making some adaptations in Calgary to specifically to make sure that they have a strong engagement with their Indigenous community. So the real reason I'm here to speak to you today is that I think there's an opportunity to collaborate between Planet Youth Lanark County and the work that we're doing in Lanark County across Leeds, Grenville, and Lanark County. We share a very supportive health unit and school boards, and there would be an opportunity if your area is interested to look at including students who are attending schools in your county in the next survey, which will be done in winter of 2024. In order to make that happen, there would have to be a lot of work done in your area. There's a recommended 10-step methodology for getting ready. Steps 1, 2, and 3 are the steps that you undergo before you actually do the survey. There's a lot of community engagement that needs to happen here. And I guess in a way, this presentation I'm making today could be considered the start of that. I would also like to tell you that we're presenting to the Lanark Leeds Grenville Ontario Health Team. We actually made an initial presentation at the end of September, and we're presenting to them again next week. And what we're looking for there is we're looking for some support because, as I said earlier, we are a volunteer group, but we've come to the point where we need somebody whose job it is to kind of push this ahead. So there's an opportunity, I believe, I hope, that the OHT might be able to provide some funding to hire a person who could serve both Lanark County and Leeds Grenville. And the idea would be to kind of get us over, through the community engagement and the disseminating data in Lanark County, as well as assisting Leeds Grenville in investigating more closely the possibility of adopting this prevention methodology. Our steering committee is available at any time to share lessons learned. And I think there'd be an opportunity to develop and share resources as we would move ahead. What we learn, we're happy to share with you, and you will have your own learnings, which we would like to learn from. So this was a motion that was proposed in the presentation to the Prescott Council. And at the end of that presentation, the feedback was, well, this looks like a pretty good thing to do, but maybe we should be talking to the Tri-Council and see whether it could be a Tri-Council endorsement to look more closely into how this model could be embraced across all of Leeds, Grenville, and Lanark County, including some level of collaboration. And I think that's the end of my presentation.
Thank you very much, David. Thanks for going through all that. Some really interesting information and a fascinating program overall. So I'll open it up for comments, questions from those around the table. Mayor Moinkamp.
David, this group had talked about getting its what used to be called the South Grenville Municipal Drug Strategy group together. It probably was functioning about 4 or 5 years ago, and it slipped into becoming essentially a meeting of agencies discussing their experiences with the community, which is very useful for them, but it kind of lost the interest from the municipal political side of it. So it kind of merged into a not meeting. So we're very anxious to get it going. And I know that recently Dr. Paula Stewart, before she retired, was extolling the Planet Youth model and something that all of the municipalities in Lees and Granville should be considering. This was during one of her presentations to mayors and CAOs that had taken place on a regular Friday basis. So there's certainly motivation for us to get going here. And so I'm trying to completely understand, and I know it's going to take time, and I'm just asking some questions here that'll probably stimulate some thinking, but I don't expect that I'll get the answers to say, okay, how should we be forming ours? Because it's obviously going to be with the opportunity of having consultations with you and Brockville and others, get our feet on the ground and find out what we're going. But on a personal level, I've got kind of an itch that needs to get scratched. Before I moved back to this area, I lived here in Brockville when I was young, but my family moved to Ottawa, so I had my education and career basically there. When I was there, I was involved for about 15 years in sports, and it was more or less at the elite level, and it was families in the far west end of Ottawa, and so reasonably affordable houses and reasonable amounts of discretionary money. We saw that there were challenges for the youth, but it was based almost youth being exposed to the things that we hope that they don't get attracted to, but it was on the basis of very strong youth that had been well supported as they were growing up, and by virtue of the relative disposable incomes, had opportunities to try many things. And so there was a great resilience already built into them. So when we were talking about what we would do in this kind of a Planet Youth approach, it's a very different one than I met when I moved back here and got involved in politics, and was drawn by the organizers of Connect Youth. And I think you may be aware of them, but it's essentially a group that's located at high schools and is there to be a resource, but also an early signal or an early pickup to youth that are having some significant problems with either drugs, mental health, or whatever. But clearly, and without making a broad generalization, because they're not completely accurate, the vast difference that I saw was these were children coming from families that were struggling with income, and the health unit has well established that the outcome education-wise and otherwise for youth is very much established by the poverty that they may be experiencing. But it also goes to the fact of the role of Connect Youth. Is the group that you're meeting primarily the first group that I talked about, or is it the second group that really has already got lots of problems that go into the area of why they're drinking and why they're taking drugs, as opposed to someone filling out a survey saying, yeah, I tried some booze at home, it was there, and I was out with some buddies and I took some booze there, or I tried cannabis. Are you getting the picture that I'm trying to get? Because I'm trying to establish in my brain where Connect Youth, or rather, sorry, where Planet Youth fits in. What crowd were you dealing with?
So, so Planet Youth is really about they consider the community to be the patient, if you will, is in this methodology. This is the idea about understanding what influences decisions that young people make when they're growing up, and trying to create an environment where it's more likely that kids are going to make good decisions. And so, it's removing the risk factors. Examples of risk factors are, and if you want to see some more specific data, I don't think I have time tonight, but the full reports that come from our survey are available on planetyouthlanark.ca. And in there, you can see some correlations between, for example, being out late at night on a weekend and kids who report having, a higher probability of drinking or using cannabis, those kinds of things. So, the idea here is to understand what we could do as a community to make it so that we have a healthier place to grow up. So it's not a specific intervention for an individual, it's a public health approach. I would contrast that with programs like the one you're talking about that exist in the school, looking to identify specific individuals who are at risk and reaching out to them in a reactive way. Very important. One of the other volunteer activities that I'm involved with is I'm on the board of the Royal Ottawa Hospital. and which is a specialty mental health and addictions treatment facility. We're always going to need those facilities, but hopefully we can lessen the need for them with prevention. So it's does that answer your question? Does that help?
It's absolutely helpful because I don't think, well, we could spend probably 45 minutes here and just either start defining the situation for us. The reason I'm raising it too is because we as municipalities now have responsibility for community safety and well-being. And that's the one that breaches the difference between, as I'm saying, children and youth that have great resilience and great opportunity versus those who through poverty have little resilience and their opportunities are very little. And it's a completely different set, but community safety and well-being, especially since it's so subjective in its definition, really puts us as municipalities trying to figure out what we're going to do with the two groups and where do they meet in the middle.
Right. And in Lanark County, sorry for interrupting, as I'm sure you're aware, municipalities have their own community safety and well-being plan. So in Lanark County, a kind of a model plan was created, and it was embraced by all of the municipalities, the 9 municipalities, well, 8 plus Smiths Falls, which is not formally part of that county structure. Planet Youth Lanark County, with a slightly different name, is embedded within that plan. So that is what. So this prevention methodology we're talking about is one of the is a major component of the community and well-being safety plan that exists here.
And just say thank you. I'm starting to get the picture of it. Obviously, a lot of reading and consideration as we get ours going, because we're going to have to try and figure out the population that has the greatest need and how we fit in with the Planet Youth model.
Yeah, I would say that the reading I have done on this is that some of these issues we're talking, certainly affluence or lack of affluence is a risk factor. There's no doubt, but there are other issues which don't respect some of those socioeconomic issues as well. So a lot of this is. I was talking to a gentleman in Galway today, in the west of Ireland. They're 5 years into this plan, and he was telling me about some of the things that they have done. They've provided resources that parents use to help them work as groups of parents to create a better environment for their kids. So there's lots of opportunities for doing things together collaboratively that don't necessarily cost a lot of money but can still make a difference.
Thanks a lot.
Thank you. Other comments, questions? Mayor Seah, please.
Thank you very much for your presentation. And I'm like Mayor Malanka trying to just determine how we would structure a similar situation. So I'm on page 10 of 13, and I'm looking at the picture that shows you're the first county to implement Planet Youth in Canada.
Yes.
And so this is the first time I've seen this. I haven't had a chance really to read the caption, but it looks to me as there's some sort of a board of directors or leadership group that's been established to kind of organize the surveys and then drive the response to the surveys. So my question is, what sort of skills were you searching for in building your leadership team? So I chair the steering committee. So that's the Planet Youth Lanark County Steering Committee. We have our membership is concerned community members. We have strong support from people who encounter who have experience dealing with youth who have not benefited from this kind of environment, I would say. And Open Doors for Lanark Children and Youth is a great example of that as a mental health service provider, but they're not the only one who are sitting at our table. So we've looked for people who are interested in community-based solutions. And basically what we did was we hosted a number of public meetings. People came out and listened and sort of heard the story. We brought in experts, including the two gentlemen in the middle of the picture on the slide you're looking at, and
we recruited from that. And so our meetings are open. Anybody's allowed to attend our meetings. We typically have about 10 or 15 people that are recurring members at our steering committee who help us. We have some folks who are retired educators who are helping us, and family docs, a pretty broad cross section of our community. I don't know if that's helping. I don't know if that's a direct answer to your question, but basically community leaders, people who care.
Pass.
Any further comments, questions? Councillor Shankar, please.
Thank you, sir. A couple of questions I have for you. You said the survey that you took in Lanark County was during COVID? Or
Yes.
the lockdown? And you didn't say how many teenagers took that survey.
I can follow up with the exact number, but it's just under 500, I think.
Okay. That's fine. Now, would that survey be skewed by the fact of COVID the last couple of years, staying at home alone, nothing to do?
Well, it's interesting. There's mixed data on that. I've in some of the meetings that I've been in with folks from other communities who have been implementing surveys before and during the pandemic, they're finding in some ways there was greater parental supervision of kids. They weren't out as much necessarily. So in some communities, they have found that rates of alcohol consumption, for example, went down. I don't have a baseline to say whether that happened in Lanark County or not. I'm not sure if that statistic I said about not feeling safe at school is related to the pandemic or not, although there is a companion document, if you'd like to read it, that's available on our website, which is a so-called asset map report. So that's a qualitative report, which matches the quantitative report. And in that qualitative report, I think I see young people saying that they're experiencing bullying, for example, at school, and maybe that's driving some of that feeling of not feeling safe. I should have also said that the reports that are available on our website, there's one for every municipality. So there's an overall Lanark County report, and then I live in Carleton Place, so there's a Carleton Place report. There's a Mississippi Mills report, Beckwith Township, so on and so forth. So each municipality can see how their data compares to the county-wide data.
Please.
I do thank you for your presentation. I do have a question, though. I'm looking online. Is there a way you can briefly describe what is involved in your prevention model? Because that's not in your presentation at all.
Sure. So it's an evidence-based model. So the evidence is reflected in the results, the reports on the surveys. Our next step, and the step that we're going through now, is to disseminate this data to communities and start a community conversation about what we're seeing, and then working with the community to decide what is it we want to do, what issues, if there are issues that we want to deal with, what issues do we want to take on, and the recommendation is pick 2 or 3. So what we're going to be doing is in mid-November, and you're all welcome to attend if you'd like. We're going to be organizing a public meeting, which will be a hybrid meeting. It'll be in person in Zion Memorial United Church in Carleton Place, but we'll be broadcasting it by Zoom as well. And we're going to present the data to the community. We're going to have some presentations about what other communities have done, what kind of interventions that they have taken or attempted to deal with similar situations in their communities. And I can give you a spectrum of what they might be. The least costly intervention, or an example of that, would be parental groups. So in some communities, when you enroll your kid in kindergarten, You go along there and you get assigned to a group of 3 or 4 other families, and your assignment is to have a cup of coffee with the other parents. And after 6 weeks or so, you get assigned another group. And so after a school year or two, and assuming your child is in the same cohort as stays in that same cohort, so they're going to school together, you start to know the parents, so that if my grandson Grayson, that's a real name, my 4-year-old grandson who started school this year in Carleton Place, if he's being a bully, maybe you feel comfortable enough to call me, because I'm saying I was his dad at that time. So it's kind of creating community around the children, and then maybe creating some norms about how you're going to parent together, so that everybody kind of has a supportive environment that way. That's a cheap thing. It costs time. The most expensive intervention that I'm aware of is something that's been used in a few communities, and sometimes it's called a leisure card. And it addresses the issue that we were talking about before, about the cost of participating in sports. So in those communities, every child gets essentially a credit that they can spend at accredited on accredited activities. So it could be sports, it could be hockey or baseball, could be music lessons, it could be theater, it could be art classes, you pick it, dance. And in that particular program, you don't have to prove that you need it. Everybody gets it. So it's kind of an equalizer. So everybody gets to participate in some of those activities, because a huge risk factor is not having things to do after school, particularly if you're home by yourself as a young person. So that's one of the things it's addressing there. So all of these things are looking to create, as I said earlier, trying to create a better environment to grow up in. You create more resilience in kids. That was a term we heard used earlier in this conversation. And the idea is that from a public health perspective, you'll end up with healthier kids who grow up into healthier adults who become the leaders in our communities.
Thank you. Thank you, Councillor Shankar. Any other comments, questions? Councillor Cameron.
Yes, I just wanted to say thank you, David, for the presentation. And because it's this particular time of year, if I'm successful in being reelected, then I will be reaching out to you for a little more information. Thank you so much.
Well, thank you. If I may be so bold, if in your wisdom tonight, if you would feel comfortable with adopting some sort of motion or some sort of communication that says you think it's worthwhile looking into this in more detail, that would be very useful when we're presenting to the OHT next week. So I'm not asking you for a commitment of money, but I'm asking you for for an expression that you think this is worthwhile looking into more deeply.
Thank you.
And I actually have a suggestion on that. With the only thing is, like, we've got a quorum here with Prescott this evening, but we only have a couple representatives from Edwardsburg Cardinal and one from Augusta. So my suggestion on handling all the motions this evening is that we just a motion to refer the items back to the other council. We have been endorsing here, and I don't think we're in a position to say endorse tonight, but I would like to at least refer these items back to the council. So at least it shows we did some work here this evening, and we also are potentially moving some of these items along. So if everyone's comfortable with that, I think that's probably the best way to handle this tonight. So we're not endorsing, but we are referring them back to the councils. So with that, and if there are no further comments, I would suggest a motion to refer the Planet Youth motion to the 3 individual councils.
I would move that.
Thank you very much, Councillor Cameron. Do I have a seconder? Councillor Shankar. Any further discussion? Seeing none, I'll call the question. All in favor?
Aye.
Motion is carried. So, David, you didn't get exactly what you asked for tonight, but it's probably the best we could do under the circumstances. So this will go back within the report. That'll go back to the 3 individual councils. And if nothing else, it's good seed for the new councils as well, because you obviously have spoken to a number of people around the table, some that will definitely be here going forward. Well, I guess just one definitely be here going forward, but I mean, that still doesn't hurt. So I think it will move it along. So that way you're not starting from scratch when the new councils are seated in November.
Sounds great. So I'll make two closing comments. First one is I will send as soon as we have a date settled for the public meeting I talked about in November. As I say, that'll be you could dial into that virtually if you'd like to. So there'll be more information available to you then. And the last thing I'd say is that one of the things I learned from the chief of psychiatry at the Royal during the pandemic is that the expression of gratitude is an advanced practice in promoting mental health, mental wellness. So I'm expressing my gratitude to you tonight. Thank you very much.
Thank you. I think Mayor Malenka had another comment. Mayor Sayon.
Just to tag on what Councillor Cameron has said, we have discussed this as a group. There was agreement that we, as the three municipalities, would restart our South Grenville Municipal Drug Strategy with the expectation we would rename it early on, and that I had volunteered to be its chair. So I will repeat essentially what Councillor Cameron said. If I'm elected, I will certainly be approaching you as the chair of that committee to get it going in partnership with the health unit.
Thank you, sir.
Mayor Sayon.
No, just thanks.
Thank you. Thanks again, David. Thanks for sharing your time with us this evening. Great presentation, and nothing definitive this evening, of course, but it is moving along, and I think you've made an impact again with those of us around the table who've seen the presentation before, and those who are just seeing it for the first time. So thanks again, and have a great evening.
Thank you. Have a great meeting.
Take care. Okay, and that is item 7 for our delegations and presentations tonight. Thanks, everyone. So 8 focused discussion. We do have 2 items there. And item A is healthcare recruitment, which is sort of risen to the top of the agenda of these meetings these last couple of months. So I will turn it over. We do have a presentation on that. Mr. Armstrong, you're taking the lead on that, I believe. So Matt, if you could take it away through your presentation.
Thank you very much, Mr. Chair. So this evening we're focused on physician recruitment. We have had discussions with Dr. Matthew, and so that's kind of the basis of what we're talking about this evening. There's still work to do on potential for nurse practitioners and other healthcare that certainly want to work on physicians. So we come up with basically a 4 facets or approach that we could divide into to this. Municipalities can aid in developing a physician recruitment plan. I'm talking about the area, what's available, how you live in South London. Next is municipalities providing a financial incentive for physicians to set up practice and accept patients from all 3 municipalities. Help getting blood work completed. That was a highlight of a struggle for the family health team, as well as an advocate to be included in the list of underserved areas for family physicians to access provisions. So from the recruitment package perspective, we can talk about healthcare resources. So in South Grenville, we have 2 hospitals within 40 kilometers, being Brockville and Winchester. We have 2 tertiary care hospitals within 110 kilometers, being Kingston and Ottawa. There's a CAT scanner in Brockville, acute and community mental health services in Brockville, and also an MRI scanner, which obviously is important to physicians, diagnostic standpoint, which will be done in the next couple of weeks. From a location standpoint, we are on the bank of the St. Lawrence River. We're 1 hour to Ottawa, 2.5 to Montreal, 3.5 to Toronto. That's how I drive. Some people make it a little bit quicker. We're near 3 international airports, being Ogdensburg, Ottawa, and Montreal. I did look up to make sure that Ogdensburg was an international airport. I'm not sure where they go internationally, but they are an international airport.
Yeah, they just signed a new agreement, I think, in July with the new carriers, so they're back and up and flying again.
We're located on the Windsor-Quebec Rail Corridor, and we're minutes from the International Bridge. And finally, community. And we have a lower cost of living, including housing, in comparison to Toronto and large urban centers. We have a much less stressful daily commute and not stuck in traffic. If I see 4 or 5 cars on my way home, then it's a big day for me. Surrounded by nature and cultural heritage, we have an abundance of recreational and leisure opportunities. We have small town rural living, and also we've instituted the transit service. So all of those together, we can really flesh out a nice professional looking package that not only can be used to position improvement, but really any employer would be able to use that across South Granville to really talk about what we bring in terms of opportunity here. So from a financial incentive standpoint, we could provide a financial incentive for the first 4 years. That's been done in a number of other municipalities. And I believe CAO McDonald mentioned that when he was in South Dundas, that they had a similar plan. We sign a service agreement with the physician that they're willing to take patients from all the municipalities. They have a commitment to stay for a minimum number of years. And if they happen to leave before the minimum number of years, then they would have to pay back a portion of the incentive. We just used an example of $20,000 for 4 years for a total of $80,000. That would, if you split it 3 ways per municipality, at $6,667 per year per municipality. So you can see that 20,000 is a fairly large number, and then when you break it down across the 3 of us, it becomes much more manageable. And then financial commitment from municipalities would need to be part of the 2023 budget process. So obviously that will happen after the election and as we move into 2023. So just a point of ponder that I believe it was mentioned earlier, that's now a good time to start having these discussions. Help getting blood work completed. So there's a couple of things that we can do here. One is showing patients how to get from their community to Brockville and home again. So really just, social media, that sort of thing, to say, if you live in Cardinal or you live in Prescott or you live in Maitland, this is the times of the buses you could take. This is how you get to Life Labs in Brockville, and this is how you get home again. So we really kind of demonstrate how that would work. And so that just people are knowledgeable and know how that can occur. Next is working with funded and charitable organizations to connect them with patients to help them get blood work appointments in Brockville. So previously the local health integration network, as well as through multiple, in particular the Ministry of Health, does provide transportation services to get patients to appointments. So this is something that we might be able to explore to make sure that patients are getting their blood work. And finally, a more medium-term type of initiative would be looking and working with either Life Labs or a third-party lab to have local clinics to draw blood or have a pickup of specimens at the physician's office. So those are just a couple of ideas that are right there that we could, low cost is just showing people how to use the Riverwood Transit. Second is trying to make organizations that provide that transportation service. And thirdly is actually getting someone to pick up the specimens right here in Prescott. And finally, advocate for family physician under service area status. So the province has a northern and rural recruitment and retention initiative. It runs between 80,000 and 117,000 paid over a 4-year period, which actually matches the amount I mentioned earlier, the 20,000 over 4 years. So exactly the same concept. The interesting part that I found is Prescott, Augusta, and Edwardsburg Cardinal are not on the list of eligible communities. However, North Dundas, South Dundas, North Swanlaw, North Glengarry, South Glengarry, Central Frontenac, and North Frontenac are on the list. So I think it's incumbent upon us to really have that discussion is how does municipalities that are just to our east qualify for that and not dissimilar to our municipalities here, and how could we to that list? Therefore, provides a greater amount of that incentive, not only from the province perspective, but what we can do locally as well. That's really the presentation as we want to bring it forward, and really it's a multifaceted approach to dealing with some of the barriers that we see there.
I'll just start off by thanking Mr. Armstrong. Great presentation. Thank Dr. Matthew as well for her assistance coming to that last meeting out in Spencerville a few months ago as well. But Matt, do we have any specifics on why we're not on that list of eligible communities?
In fact, the number is based on fairly old ranking. I believe it was from 2008 is where the score is derived from. So that's something that we need to follow up with the ministry and the province to say, you know, is there something that we can do to update that number? And then where's our number in comparison to the ones that are on the list versus off the list, so that we can really understand how that works. Because when I take a look at something like our Ontario Municipal Partnership Fund, we have a fairly high rural score. So we would think that that would prompt rurality in that type of thing. And I think we've also demonstrated that we only have the Prescott Family Health Team that is accepting patients from Cardinal or from Edwardsburg, Cardinal, Augusta, and Prescott. So, and other family health teams might be also, but they're more on the fringe. So now you're talking about more transportation involved. So those are some of the things that we have a lot of questions for. But really one of them is, you know, is there an intention to upgrade or update that from a 14-year-old?
Yeah, some interesting questions, just because, I mean, you look at it initially and you just think, well, we're too close to Ottawa, but obviously that's not a factor because of the other communities. And then you think, well, maybe we're too close to Kingston as well. We're kind of in betwixt and between with the other hospitals in all the regions. But then you look at Central Frontenac and North Frontenac as well. So it is kind of hard to understand. So that's something I think would be good to look at and ask some questions for sure. Councilor Cameron.
Yes, thank you, Mr. Armstrong. But I just do have a question. And if you want to refer to a page, it's the page that starts with aid in development of a recruitment package. And you were talking about the hospitals within a certain area. Why wasn't the Kemptville Hospital mentioned in that?
So it's mentioned in the first line, so 2 community hospitals.
I'm so sorry, I missed that. Yes, it is.
You actually said Winchester when you were doing the presentation.
I thought so too.
Yeah. I did have Winchester.
Yeah, and Winchester should be in there.
Yep, and they're
Yeah,
Little
for
first.
60 kilometers away. So I kind of made a choice to kind of pare it down a little bit.
thank you so much on that.
Thank you, Councilor Cameron. Other comments, questions? Councilor Young, please.
Thank you, Brett. $6,600 does not seem like a very large number on our $10 million budget.
You have 10 on that?
Yeah. But for the municipality. But when I was thinking about this 6 weeks ago or whenever we talked about it a month ago, we all have very wealthy industries or individuals in our community that might be interested in participating with us and could either share the $6,000 or beef up the $6,000. Just planting that seed.
It's an interesting point. I just take a moment to, at the St. Lawrence Corridor Economic Development Commission, we have talked about, I mean, it's connected to this, but it's not exactly the same, about moving more to looking at how we bring more residents into the area. Because the biggest issue we have with a lot of the industrial, like we can attract the Leclercs, we got Canarm growing, Northern Cable's growing, but the big issue is we don't have people to take the jobs in a lot of cases. And then you've got the housing issues and so on. And then that was something that did come up, I think, at our last corridor meeting a couple of months ago, is, you know, how do you get a family here if you've got that issue with getting a GP, getting a family doctor? So that's an excellent point. That's something that could tie into, there's the corridor and there's also an industrial group as well. That's a meeting connected to the corridor, but separated as well. That will be advancing some of these priorities in the not too distant future too. So that's actually an excellent point, because if you can't get family doctors, it's going to be awful tough to get younger working age people to move here. So excellent point, Ryan. Gory, I think you had your hand up.
Yeah, I think if we could somehow get on this list, that would be great. If not, I think, you know, us talking about $80,000 seems to be right in the low end of what they're offering. Maybe we think about offering like $100,000, which is only 25,000 a year. And then maybe that makes us a little bit more appealing to the recruitment. But by all means, if we can somehow get on this initiative, that'd be great. I'm trying to look online to see, the frequently asked questions and stuff like that. And it'd be nice to know how many of these they're successful with. Like Steve, you did say that, so Dundas did get one. I don't recall when that was.
So would have been probably in the 2008 to 2015 area.
Okay.
The doctors moved into the municipal. At that time, we only offered 10. You can see that, costs have certainly gone up. But we were successful in recruiting, I think, 4 doctors over that time period. Anything further, Councilor? Thank you. Mayor Sale.
Thank you very much, Mayor Todd. So first of all, thank you, Matthew, for a great presentation and a great framework here. And as I said in my opening remarks, I kind of thought that there would be implications for the 2023 budgets. And if I'm reelected, I certainly would be prepared to recommend that our council look at participating in a 4-year program, at 6,000 or so a year. And my personal feeling is that that's on the low side. And I just wanted to add another dimension to it, because in a previous life, one of the things that we found that was a real help in recruiting the physician was providing a place for them to live. When you're recruiting in the large metropolitan areas such as Toronto, and you're trying to attract somebody to this area of the country, the first thing they want to know is, well, is there a place to live? Because doctors really don't have time to spend with real estate agents or doing a reconnoitering in the townships. And if you're able to say, listen, we have a 1 or 2 or a 3-bedroom house located such and such a place, and we'll make that available for a year or a year and a half or 2 years, rent free, it makes a big difference because it removes a barrier. And so, just another factor to enter into a package like this. The last thing that I just wanted to mention is that somewhere in the presentation, I forget just where Matthew alluded to it, is the issue of drawing up a contract that we would sign with that doctor or with a potential recruitment target. And I would hope that some work could be done between now and the new year in developing such a contract and bringing back a draft for our review, because that is a sort of a sine qua non condition that would helps both sides of the organization, both sides of the issue, define where exactly they're standing. Here's the deal. It's in writing. We're prepared to sign it. We're giving it to you to look at. This is what's included. And that makes a big difference when you can actually present somebody with that package in writing. So those are my comments, Mr. Chair, and I think it's a great presentation and a great framework. I'd certainly be prepared to support it.
Thank you very much, Mayor Sea. Other comments, questions? So I think we're at the same point as we were with the last item, a motion to refer this back to the individual councils to see about an endorsement. I would ask, at least from Prescott's perspective, we try to bring this back as soon as possible. I'd love to refer this on. So it's something that's there for the next council. I mean, I don't think there's any point of waiting on this. We've got a whole month and a couple of days left, so we might as well make it count. So if someone's proposed to make that motion that we refer this on to the 3 individual councils, I'd be happy to entertain that. Councillor Young and seconder, Councillor Cameron, and any further discussion? Seeing none, I'll call the question. All in favor? Motion is carried. Thanks, everyone. Good discussion. And Matthew, thanks a lot for putting everything together there. And extend our thanks as well to Dr. Matthew. That may be kind of our ace in the hole because she's very involved, obviously, and she is a reasonably new person to the area as well who was recruited here. So she actually has all that experience of moving to our area quite fresh in her mind. So I think all her professional and personal experience would be incredibly valuable there. So good stuff. And it's great to see that we're moving forward on that. So we do have one more focused discussion this evening under 8B, and that's the creation of a developer package. And I believe I'm going to, is this Steve? Is this you? So Mr. McDonald, please take us away on your presentation tonight on the creation of a developer package. This is also for everyone that doesn't know, this was an item that goes back quite a little while now, does it not, to Augusta Prescott meetings early on, the idea of creating a package we can give to developers so it's no muss, no fuss, easy shopping for developers that want to develop here in Augusta and Prescott. And we do hope that all three of us will take part in something like this in the future. For the long preamble, please go ahead.
Thanks very much, Mr. Chair. There's just really a couple of things I want to point out because not a lot has changed, but the changes are I think, very important to note. So Augusta awarded the conclusion of the secondary plan to Folk 10 Planning and Design and approved their work plan on August the 8th. So Folk 10, we've had several moving ahead. They have a very ambitious time schedule to complete that. We're actually looking at perhaps the first quarter of 2023 for the policies to be approved by council. And then of course, we'll be waiting upper tier and then the implementing zoning bylaws can and once the secondary plan is approved. The other thing is that council also at the same time in August awarded the completion of a development charge background study to Comp Consultants. I understand that Town of Prescott has done that as well. So that is proceeding as well, and the development charges should come in nicely at the time frame whenever the increased density or the increased development is going to happen west of Prescott. Really, those are the points. The other issues that are kind of the other issues are really haven't changed much, and a lot of them are dependent on how the planning comes out of it. I will advise that there is going to be the consultants are doing a design charrette scheduled tentatively for the end of November, which will be a very intense 2-day workshop with agencies, stakeholders, and public involvement. Basically, planning policies will be written by the people that attend, and consultants take that away, write the formal policies, and send them back to us. Those are my comments. Mr. Chair, and if Mr. Armstrong has any comments on the Prescott aspects, I'm glad to pass it over.
Thank you very much. Matt, anything further to add to that?
So we have passed our official plan, and as CIO Donald mentioned, we are embarking on our development charges study. And then our next step for doing plans is a zoning bylaw, which will occur in 2023. So I think it works well in terms of timing, and it should move forward quite nicely.
Excellent. Thank you very much for the presentation, Mr. McDonald. Thanks for the added items. Mr. Armstrong, I'll open it up for discussion, but I want to start off with a thank you to all our partners in Augusta on this, and it's no slight to Edwardsburg Cardinal because Augusta was at the table just a little earlier on this, but this is fantastic stuff. I mean, the fact that we've really tackled this and we're moving along really quickly. Augusta is moving along really quickly on this to align some of the policies. So we're working together completely on development, and the timing is right too, because we're going to see more and more developers. We're seeing some. We've announced 1 or 2 projects in Prescott. I'm not sure if we've actually officially announced the second one or not yet, so I won't say anything more on that. But we've got some housing projects here on the way. I know Edwardsburg Cardinal and Augusta as well. And we'll see even more of that as the province is pushing the housing development in the next couple of years so we can make up that deficit we have in terms of housing starts. So good timing for all of this. And just really, really happy that Augusta has gone so aggressively on this, and the partnership has been so incredibly strong. And I want to say, the partnership with Edwardsburg Cardinal as well, particularly with regards to the water, wastewater, that's a big part of these discussions as well, because we're already connected there, of course, to the industrial park in Edwardsburg Cardinal that, as I said earlier, has been booming in recent years. So this is something that I think is it's going to be up for the new councils to really heavily look at this, because there's more money and more planning that needs to be committed. So this will come up in the budgets, but this is exciting stuff, and it shows how much you can do when you're committed to working together. And I'm sure that'll continue with the new councils. I certainly hope it will, because I think we've laid out a pretty good game plan here for how to move this along and make our respective municipalities more prosperous and assist in the growing of all three. So that'll open it up for comments, questions on the plan as presented this evening. Mayor Malinka.
The only one I have is that this does reflect a study that we did together using modernization dollars, et cetera, that we had received from the Ontario government. And it didn't include Edwardsburg Cardinal. So as Edwardsburg Cardinal moved into this partnership, it then made me think back to a conversation I remember having in Edwardsburg Cardinal. I think it was in Cardinal, in fact, but it may have been Spencerville. It was with relation to a company that was looking for a site, and Edwardsburg Cardinal didn't have it, so it was being offered as something for Augusta. And I remember the CEOs at the time, who are different than now, actually mentioned the fact that, some kind of a study that would identify the individual strengths of each of our communities, and develop some kind of a position that would be an indication to them of what might go in which municipality. Just to say that it was really the first scratch of saying maybe we should be starting to look at development in a broad picture and in a fashion or through the eyes of a developer. And so a long preempt to what pre-discussion to what I'm going to ask, and that is I'm hoping that Edwardsburg Cardinal will come to us early on the process and indicate how can we accommodate their needs and bring them closer into the fold, if that's possible. I mean, I'm not trying to suggest, tell them what to do in any way, but it's just that as one of the early partners in this, I'm certainly looking to make certain that the Edwardsburg Cardinal feels totally at home and anxious to take this as far as we can take it.
Thanks, Doug. Open other discussions, comments. Not seeing anything further tonight. So I'll thank staff again for Mr. McDonald. Great presentation, updating on us all on this creation of the developer package. So I would ask we do the same thing for the motion, referring this back to the individual councils for discussion there. Moved by Councilor Shankar, seconded by Councilor Cameron. Thank you both. Any final words? Seeing none, I'll call the question. All in favor? Motion is carried. Thanks, everyone. And we do have the roundtable coming up, but I'll just go to those two quick items. I think that Doug, you mentioned the drug strategy. You want to
Yeah, I
speak
just
to?
wanted to let the group know that we had really tried to work with the health unit to get an early meeting before the election came along, before we got crowded out of our ability to hold and get its first meeting going. It was not possible. It came from the health unit having some holiday issue. Also with Dr. Lee, they're going looking at a few managers competitions that are up, and so there's some movement of staff. And it just appeared that there was not an opportunity, so I didn't force it. So this is unfortunately, because I would have really liked to have had a first meeting before we go into the election. But I know that the health unit had a recent discussion with them. They're anxious to join with us in partnership to get it going. And we'll look forward, as Councillor Hugh and myself have said, if we're successful in getting elected, then we'll get it rolling ASAP. And if I'm not, then I'll pass it around to my successor and see if they will get it going.
Sure. Thanks for the update on that. And it is something that hopefully can be revived in some way. Brockville, I think, was one of the, Brockville's doing some good work, I think, with their drug strategy now. And we have been fairly active in the past. Mike, Councillor Ostrander was heavily involved there for quite a while as well. And it's just one of those things that kind of died in the vine because it became, the meetings just became a information sharing between agencies, between health unit nurses, and there's got to be a way to kind of engage the community more. And I think we'll get to that in the next term, hopefully. But thanks for that update, Mayor Malaika. Mayor Sa, you had an item you wanted to add to the roundtable as well?
Yes, if I could, Mr. Mayor, thank you very much. So I don't know whether members of council and the candidates that are in the room are aware or not, but the MTO, Ministry of Transportation, has begun preliminary design and a Class EA study on Highway 401 improvements from 1 kilometer east of Highway 16 to 3.3 kilometers west of Maitland Road. Now, on that section of highway is the CPR overhead bridge on Highway 401. And that bridge is now under study as to whether or not it will be removed, replaced, or rebuilt. And so knowing that the MTO had begun this preliminary design work and started the Class EA study, our Mr. Grant had sent a letter to the MTO advising them that the position of the Township of Edwardsburg Cardinal was that we would like to keep the existing CPR overhead bridge in place and see it rebuilt, because we know that underneath it is a 4-inch pipeline that connects the Enbridge substation on County Road 18 that comes from County Road 18 across Cedar Grove Road, and then it comes south on the abandoned rail line underneath the 401, and then east along the south side of the 401 to Giant Tiger and to Greenfield Ethanol and other places. So we feel that that overhead bridge has a future. And the reason I'm bringing it up now is because MTO is just in the initial stages of doing their review and their Class EA study. And the essence of my comment here is to seek support from the other two jurisdictions, Prescott and Augusta, to see whether or not those two jurisdictions would support our positions. So I'm just suggesting, Mr. Chair, that I've made it sort of public at this meeting. Mr. Grant will circulate the pertinent correspondence to your CAO and the CAO from Augusta. And then at some point, perhaps it'll come on to your agendas. And if you're so inclined, we would appreciate support from those quarters. We know that there is a second round of discussions that will take place sometime in the fall of 2020, but MTO has not yet announced when that will be. But when it is, we intend to be present, and it would be great to have your support when we're there. So I'll just put that on the table, and thank you for the opportunity to get it on the agenda.
Certainly. Thank you very much, Mayor Sayles. Everyone's okay. We can refer that one on as well and get some more information on that from staff as well. I'm not sure what the consultations have been there. I know there have been some discussions with regard to other 401 work in the last year and a half. So that's actually something from our own council, just an update overall on the 401 issues and so forth, because we've obviously been involved, myself and the mayor's caucus and the United Counties, the pitching for the 401 expansion as well has been a fairly significant issue for quite some time. So we get that back on the agendas at the councils.
I think it's an excellent idea, and I think we should be asking our CAOs to look at the document in terms of mutual support of the various priorities for us. One of the things that I'm getting on my door knocking is that in the Class EA study that's being referred to here for work on the Maitland ramp, there's a lot of concern on the part of citizens. They're hearing also, and I don't know where they're getting it, quite frankly, but they're hearing that there may be a ramp at the Blue Church Road, an off ramp at the Blue Church Road. I'm not sure where that's coming out, whether it's one of the councillors presenting it in their door to door. It's not something that I would be responding as having anything close to a certainty with regard to MOT, but we really should be looking at the three municipalities in terms of have our CAOs identify issues that we need to discuss and make certain that we're on board with it. And then if we are, as a leveraging group, then support them all.
Sure, yeah, excellent points, and that's how we've, I think that's how we've always operated with that Augusta Press Guide group too. So those items are brought to the councils for a joint endorsement and work together. So sounds good on this one as well. So thanks very much for bringing it to us. So we'll refer that one on to the councils as well. Just in terms of, so there's no more formal roundtable, so we'll go around the table, and Ray's already got his hand up, so I'll go with Councilor Young.
Thank you, Brett. It's probably been a year since I've mentioned this, maybe a bit longer than that. I would like to get rid of that water that stands north and south of the 401.
So we all.
We all would. And it affects all of us. It affects us in our development, future development. And the water is approaching Fort Town Drive. It is flooding basements on Fort Town Drive that are houses that are owned by the United Counties. It's preventing development in our east end. It's preventing development in Edwardsburg's west end. It even affects Augusta up north because it goes all the way to Cedar Grove Road. And I've been told by local experts that all it takes is removing the beaver dams. Now, I don't know whether that's true or not, but I know Mr. Grant and I have talked about this several times over the last 5 years or more. And if there was ever an opportunity to plug the province for some money to help out with this, or Granville Community Futures to help out with the 3 municipalities and doing a study and figuring out how to get rid of that water, I think we should take advantage of it.
Good point. It's been a major issue for a long time, and it is encroaching. It seems every couple of years we have flooding that gets right up to the foundation of the houses at the end of Fort Town.
Yeah.
So it is getting worse, whether it's beaver dams or more issues with it. But I'll turn it over to the CAOs because I know we did have the discussion on the water on the north side further to the west, and we were engaged with the South Nation Conservation Authority. And any comment on that, Mr. McDonald, Mr. Armstrong, on where that is? And if, I know we were sort of focused more on that area to the west off of Development Drive, but Ray's talking more, well, it's all part of the same watershed, it's the same issue. But have there been discussions on that in regards to this issue with the Conservation Authority? Because I'm assuming that's where we'd have to go first for discussions on this, and I'll let Pat comment on it. Just Matt, did you want to? That's real quick.
We haven't talked about in particular. The one that's more along Development Drive is in the evaluation process, but it doesn't have a long standing water to it because we already had the stormwater management pond and whatnot to do. So I think it's a slightly different issue from what we see on the other side of Edward running up to Cedar Grove.
Probably is something we would have to raise with the Conservation Authority at some point, though, because it does go into the townships, and it's got to be part of their overall region. Pat?
Well, I don't know how to put this on the table. It's a little bit embarrassing because I've been talking to Councillor Young about this issue for quite some period of time. And let me first of all say, really, the South Nation Conservation really doesn't have jurisdiction on this issue. This issue comes under the Drainage Act, the Ontario Drainage Act. And there is, or there was, natural drainage in that area at some period in the past. In an effort to address the issue, I persuaded the United Counties to petition the township for a drain, a municipal drain. And I defined the area quite clearly to the United Counties as going as far west as Boundary Street. And that's the way I pitched it to the United Counties. The United Counties followed through because they know that they have a problem underneath the rail bridge that crosses County Road 2. They followed through and they petitioned the Township of Edwardsburg Cardinal for a municipal drain. We engaged the drainage engineer and there's only one really reputable drainage engineer in Eastern Ontario, and he's very, very busy. It took something like 18 months just to establish the area. And during that period of time, I lost control of the issue. With the result that the defined area for the drainage, for the municipal drain, did not go far enough west. Yes, oh no, did not go far enough west, but it certainly included the water west will have to come east, if I can put it that way. So what is the good result that's come out of this? The good result that's come out of it is that the defined area will be outlet into the St. Lawrence River through 2 identified and agreed upon outlets. One of the outlets is the outlets that is underneath the that's underneath the spur line bridge that crosses to the port. That complete project is now underway, and that will be the official outlet for the west side of the drain. Now, the east side of the drain will outlet down through Edison Drive, and there is a defined outlet down there. We put out a tender. Well, no, let me go back a step, because there were several public meetings held about this, because the way a municipal drain works is that the cost of the municipal drain is borne by the land that is benefiting from the drain. The drainage engineer has to determine every parcel of land that's going to benefit from this drain and assess a value to that parcel of land. And the assessment schedule for our drain is about this long, if I can put it that way. Each parcel identified, the owner for each parcel identified, and then the cost of construction identified. We put out a tender to have that municipal drain constructed. Now, Mr. Grant can help me out a little bit here. I think that our initial tender came in over our estimated costs, and we've somehow deferred the start of that construction till 2023. Is that correct, Mr. Grant? The one thing is for sure, we can't begin construction of the west side until the work underneath the rail bridge is complete, and that just got started this week. So, Mr. Grant, help me out a little bit here. Where is our construction of that municipal drain? Where does that stand right now?
So through the mayor, the west branch will proceed this fall, but the east branch work will not begin until 2023.
Right, and I think the west branch goes as far as the CNR spur line south of the CNR main line, and I think it also includes on the north side of the CNR main line. So we will be doing the construction of the west side of that municipal drain in the spring of 2023. We're hoping that that will capture some of Mr. Councillor Young's concerns, because that's the natural flow. Now, what is the next step here? Other than to see how it all folds out on the ground when the construction begins. The big issue that we're going to have is the following. All of the benefiting landowners must participate in the cost of the drain. I've seen one where the landowner is going to be assessed $60,000. One of the major benefiting landowners is the CNR, because all of their lands are going to have to access that drain. CNR is notorious all across Ontario of refusing to pay their assessment costs on municipal drains. And that's an issue that we're going to have to work with AMO and a number of other bodies to see if we can't bring pressure to bear on CNR to pay their costs of these municipal drains. Now, Mr. Chairman, that's the Coles Note version. And I'd like to let it sit there until we see what happens in the spring of 2023.
Okay, well, thanks for the update on that, because it does show that, work is ongoing, and but unfortunately, there's obviously some issues and mentioned about not going far enough and so on as well. So this is one of those to be continued items that we'll have to leave on the agenda for the next group to look at as well. Doug?
Well, I think I'll just put up the same kind of comment as Ray has given. And that is, we have had relations for almost 3 terms. It was first at the South Grenville Chamber of Commerce and many others. And we've discussed, and I call it sort of referred to it humorously when Trump was getting going, as our draining the swamp that's up at 18. And the thought was that we would look at that together. So I think that through necessity, Edward Burr Cardinal had to jump ahead and get going with it. But I would really like any opportunity to try to look back and figure out how we can add in or join into the program would be very good, because we have a historic drain superintendent in Augusta that has given the same kind of a story that with a good shovel, you could clear a lot of the drainage out of there, in addition getting rid of whatever beaver activity is going on. But the more significant comment that I had, and I'd have to have an engineer confirm it, but his initial statement is that the high water table that exists in Riverview Heights would be alleviated by draining the swamp. And this is something that is very much of interest to Augusta because of the proximity of wells and septic systems in a built-up settlement area. And so this is really something that I would appreciate if we could really look at and see what opportunities exist for working together on this and hitting a common problem.
So, Mr. Chairman, if I can here, to just add a little bit. First of all, the report of the drainage engineer is available to both councils. And if you'd like copies of them, Mr. Grant can certainly make them available. But what I would suggest that you would do is you would have your engineers look at those preliminary design. Well, they're not preliminary designs now, they're approved designs. So the next step I think, is for either Prescott or Prescott and Augusta together to petition us for a municipal drain that would connect to our municipal drain. And then we would be forced to start that process again. And we would engage the same engineer saying, we want this municipal drain extended to this area. And that would be the mechanism. Remembering, of course, that all of the costs of the study and the construction goes back to the participating landowners. But I would think certainly for you to petition us, even at this stage, would be quite appropriate. And maybe even, well, I don't think it could be probably added to the 2023 construction season, because by the time the municipal engineer gets his initial report done, we'll be well into 2023, even if you petitioned this before the end of this year.
Well, it's great. It's great information to have as well, and it sounds like a plan to me. And the one thing I will add on this is Ray's right. Everybody that's spoken is right on this. But just to put it in perspective, you're talking about enough land that could potentially host hundreds, if not even thousands, of units to help deal with the issue with housing in Eastern Ontario, and particularly right here. I do think we are on the verge of a real boom. We're starting to see it with a lot of the ECDEV, and we're seeing it with the housing now as well. It's front and center with the province, of course, and this would be a way to really open up some significant tracts of land for housing. And maybe it is something that could be resolved in the end with, the doer plan with, 5 guys in a backhoe. And we've got 2 candidates here tonight, and I'll just mention both of you. This is unfortunately the kind of thing you're going to run into all the time, is simple solutions that turn out not to be simple in the end, despite the goodwill of everyone to try to resolve it. Because this one has been with us for quite some time, and hopefully it is something that's resolved in the next year or two. It sounds like some progress has been made. But, that doesn't even get into potential environmental issues and, all the other stuff that goes part and parcel whenever you're talking about water. God forbid you find, what's everyone's favorite tree? Butternut tree. I don't want to find too many of those on any sites you want to develop either. But anyways, cautionary tale for you guys on this stuff. But it does sound like there's good progress pending here. So we can move off that item. Good information, but we'll just finish off the roundtable. I'll just go around the table quickly, give everyone a chance. Starting off, Councilor Cameron, any last words tonight, you?
Nothing. Thank you. Thank you. Thank you.
Thank you. And on our side, Councilor Ostrander, any final words?
Extra large thank you to Mayor Sayoff for that background information on that drainage. I live over in that quadrant, and the subject comes up annually, sometimes monthly. And it's nice to see that there is a palatable solution. Still a lot of legwork to be done, but still it's the dynamics have been at least explained and laid out to go forward with it when feasible. So thank you for that. And it sounds like all three municipalities will have something on page 1 of their agenda when things start up. So we'll leave it at that for now anyway. Thank you.
Thanks, Mike.
I don't have too much. I thank Ray for bringing up that question. It's good to know that there's a plan in place. And I mean, the end result is a positive for all three municipalities. So I'm all in favor of that.
Thank you. Ray, anything else? Okay, one thing I will add on the water there. I mean, and this is just anecdotal, so take it for what it's worth. But I mean, all of us kids used to play back there, Hangman's Bridge, and that whole part of town back when we were younger, and it was dry. So this is something that has changed, whether it is a beaver dam issue or whatever else. And maybe there are, easier solutions to this once it gets looked at, or once the red tape and everything has been arranged, maybe you can get to that simple solution. Because it was bone dry for a lot of years when I was a kid anyways. But last words from my counterparts, Mayor Saya, anything final tonight?
No.
Doug, anything?
I just want to say, because of the election coming up, there are going to be some of us who are not here anymore. I just want to say to you all that it's been an absolute privilege and pleasure to work with you, and that goes for you and Pat and all the members of council. I'm really excited for this area, even if I ended up not part of it. If I am, then it is going to be gung ho as far as I'm concerned. I'll be quite frank with you that just Pat raising this issue has made this meeting valuable for me. If there was any question about it, this was the issue that needed to get discussed. Because as I'm saying, in my last campaign, I referred in the door-to-door as draining the swamp. Because in our discussions, we realized that the huge potential for development of that land, and also whether or not there is, it's to be proven that it would lower the water table in Riverview Heights. If it did, it would be extremely something that is valuable. And I think by raising it, even Mayor Sayo here has given us a path, a way of doing it. I'm not particularly going to be disappointed if you can't do it with a backhoe, because I get it that was easy solution. But my takeaway from those discussions that were taking place was agreement by our residents that was a valuable project to undertake. And so I thank you, Pat, for that. And thank you all for what's taken place so far.
And Mr. Chair, I should jump in and express, I apologize. I should jump in and express the same sentiments as Mayor Malanka. If I'm not here, I too want to say that I've enjoyed tremendously the opportunity of working together with everyone all around the district and United Counties as well. And it's been a great learning experience for me over the past 8 years, and certainly hope to continue. And if I am, I'll put everything into it. But in the meantime, thank you, Mayor Malanka, for reminding me of my P's and Q's. But I do want to thank everyone.
You?
Yes, just to follow up to Mayor Malanka's comments, and Mayor Malanka, I'm somewhat disappointed because I'm taking the positive road. We're all going to be here next time.
Well, I'm not, and I'm actually quite happy to say that.
Yes, you're not running.
But I did want to close off on, I just want to thank everyone around the table. This has been something, I mean, it goes back, some of this goes back to my first term in talking to Mel Campbell when he was Reeve in Augusta, because there hadn't been those discussions with our councils in recent years. And one of the first things that Mel said to me after we started that term in January, will you sit down and meet with me? So of course I will. And we started talking then, and it branched out through Mel's last term as Reeve, and then Doug as well. And I do think we've got incredibly strong ties between Augusta and Prescott, and I know that will continue in the future, regardless of who's at the table, because we've really laid the groundwork for that partnership to continue. So I really want to thank Doug for all his great work and partnership, and always being willing to come to the table on things these last few years, the arena, the water tower, so much. And I can't thank you enough. It's been rewarding personally and professionally. And I do consider you a very good friend, Doug, and I thank you so much for all the partnership. And the same with Edwardsburg Cardinal. While there've been some rocky moments there at times, we are, that sometimes that happens with the best of friends and the best of family, and you get over that and you move on. And I think that's what we're doing now. And I have every confidence that whomever's at this table going forward, and we know one, but I don't think we know beyond that tonight. But I think it's going to continue, and I think we've really done everything we can. I mean, meeting right. Got a bunch of people that aren't here tonight, but hey, I mean, it happens. We still went ahead with it. We pushed these items forward, and they're key items, and we've laid the groundwork for this to continue with the new councils. So with that, we'll close this off. I want to thank everyone again for such tremendous teamwork this entire term, and before that, wish all the best to everyone running, both at this table, in the audience, anyone that may be watching out there that's just getting home from pounding some signs into the ground or knocking on some doors. Thanks for all your commitment. Thanks for putting your name forward. That's what we need to continue building our three great communities here, Augusta, Edwardsburg Cardinal, and the town of